Tuberculosis kills over 1 million people every year in the world. It is the second leading cause of death after COVID. Over 10 million people are disabled with tuberculosis every year. If people are taking TB drugs improperly, stop too early, they can develop a resistant form of TB that can be given to others. Tuberculosis is preventable and curable. I worked in tuberculosis clinic at General Hospital in Kuala Terengganu in the east coast state of Terengganu, Malaysia. Our clinic had a staff of a physician assistant director, who I worked with, 10 senior and junior nurses, a lab worker, an x-ray technician, 2 vans, and 2 drivers. We had a physician 2 days a week to see patients. Our clinic saw outpatients every day and had inpatient beds for 100 men, 50 women, and a prayer room for our Muslim patients. I identified 2 problems in our rural area of the east coast of Malaysia, which are the same problems today, 50 years later, in Asia, Africa, South America. Most of the problem with TB today are in rural parts of the countries. The cities are in much better shape. What we tried to do in 1967 and 68 could be used today. The first problem is a lack of resources. A major part of the Malaysian TB program was testing of school children for TB and vaccinations of those not infected. There were enough resources to do this program in the schools around Kuala Terengganu, the capital of the state of Terengganu. There was not enough money to do the program for schools in other rural parts of the state of Terengganu, near other 3 hospitals. We proposed a project that would borrow resources for the National TB Center in Kuala Lumpur to do a testing and vaccinations in the East Coast rural schools and train nurses to carry on the program in the future. The second problem is that we felt there was TB in a rural area and we wanted to have a mobile x-ray van to come to this area and test the population. The National TB Center was not interested in sending a mobile TB x-ray van to a rural area of the East Coast because of the very poor response in the past efforts. We convinced them to give us a chance. We had an education program that would show the TB Center a new approach. All the TB clinics in Malaysia had a school testing and vaccination program. Our clinic staff would spend 4 or 5 days a week, all year except during the monsoon season, with heavy rains every day for a month. Our local program would do a man-2 tuberculin test on all first grade students. It was an injection in the front of the wrist. They would return 2 days later. If there was a bump where the test was done, they would be given the students a letter asking them and their parents and friends to come to the General Hospital for follow-up x-rays and a sputum lab test. There was a chance that they might have tuberculosis infection. Who gave it to the child and who else they might have given it to was investigated. When our staff returned to the schools after 2 days, all the students that did not have a bump from the man-2 tests were given vaccination, BCG, Bacillus Calumet-Guerin. This was a drug that would protect a person from TB. Our clinic visited about 50 schools a year around the state capital of Kuala Terengganu. There were 3 other hospitals in the state that did not do school testing and vaccinations. I wrote a proposal to the National Tuberculosis Center in Kuala Lumpur, the capital of Malaysia, and told them we did not have a TB testing and vaccination program in many of the schools, near 3 other hospitals in the state of Terengganu. I would like to develop a program in 20 schools in these areas with the help of the National TB Center. I requested 3 nurses to do testing and vaccinations for 4 days a week for 5 weeks for 20 schools, a driver in a van, all the man-2 test and equipment and BCG vaccinations needed, payment for housing and food at government motels in the area of the hospitals in Kuala Brang, Besut, and Kemaman. I would set up the appointments with the schools and would go with the staff to each school. The team from the TB Center would come over to the east coast of Terengganu from Kuala Lumpur on the west coast from Monday to Thursday. They would go home for Friday and Saturday, come back on Sunday for testing on Monday and Tuesdays, and readings and vaccinations on Wednesdays and Thursdays. They would do grades 1 through 6, 2 schools on Monday and Wednesday, 2 schools on Tuesday and Thursday. 4 schools per week, 20 schools in 5 weeks, for a total of 120 classes. The team from the National TB Center would take a local nurse with them and train them to do the MEN2 tests and read the tests and give the BCG vaccinations. In the future, the local nurse at each hospital would be given a van and a driver every year and testing and vaccination materials to carry on the program for the first grades that hadn't been tested before. The staff that came over were dedicated nurses and became great friends. I often had dinner with them with great laughter. Because they had left the more urban west coast of Malaysia, they found the rural east coast very different. No televisions, for example. One of the nurses kept saying it was like Gilligan's Island, a popular American television show about people abandoned together on a deserted island. A second way to find TB was through an X-ray van. Currently, vans were sent to Kuala Terengganu and would sit in the local market. Not many people would get an X-ray. We got the X-ray vans to go to the schools for teachers, to locations of public employees, police, fire, public works, army, and outside the hospitals where doctors could see patients with TB symptoms, coughing, weakness, etc. If the mobile van showed a possible problem X-ray, you were brought into the local hospital for further tests and a sputum lab analysis and a large X-ray. In our school testing program, we discovered TB in a rural area of Kuala Brang. Kuala Brang is an area of rural villages that grows rice, which they sell for other food. It is so rural that we had to cancel our school visits for a week because of a man-eating tiger. I asked the National TB Center if they could send me an X-ray van for 3 days to Kuala Brang area. They had first hesitated sending a van to an isolated rural area in a rural part of the country. I told them I had developed an educational program that I would give to get a good turnout for the X-ray van visit in the rural area. They said okay based on the recent success of our school testing and vaccination expansion program. I had been developing an education program to work with TB patients in community groups. It was slide-based. I worked with TB patients and took their advice on why they sought out care, what frightened them and their families about TB. Empathy was the key to developing the slideshow. What did they know and care about? The slideshow started with cartoons of people coughing and their lungs spotted with disease. The following points were covered. There is a disease called TB in the area that is dangerous. It can kill you and your family members or disable them. We know how to find it and prevent it from harming people. We can find it with an X-ray van. We showed a picture of the inside the van, what it would look like to go inside, to stand up and have your X-ray. You stand inside and we take an X-ray picture, another photograph. If this X-ray shows you have a possible disease, you can take a bus 15 minutes to the Kuala Terengganu Hospital. Free tickets for the bus. If you have a family member have the disease, you can be treated at our TB clinic with 100 beds for men, 50 beds for women, and a Muslim prayer room, or you can take the medication at home and come every month for new medication. We took the educational program to 2 meetings of about 10 village leaders at each meeting. I did the education program in their Malay language. I told them we would have 2 evening educational programs in large fields with government cheap generators running the slideshow to explain the X-ray van coming to a local government building, the parking lot in 2 weeks, and they should try to get their people out for the evening program and for the X-ray van in the government parking lot in 2 weeks. We ended with a question and answer period. We had about 200 people for each of the evening slideshows in the fields. 2 weeks later, the National TB Center mobile van arrived with 2 technicians and a driver. I met with them the day before and answered their questions. They brought 100 films, enough for 100 X-rays, not expecting many people in this very rural part of the country. That is what they saw in a busy day in Kuala Lumpur, the capital. On the first day, they were at the X-ray van at 7 a.m., getting ready for the 9 a.m. start. There were already 300 people waiting for X-rays. They made a panic call to the National TB Center asking for 1,000 films to be flown in immediately to the East Coast. The first day they did 500 x-rays in the van. They were shocked that so many people showed up. They called and asked for 2,000 more films to be flown in over the next flight to Kuala Terengganu. After 3 days, they did 2,500 x-rays. They couldn't believe how many people came. The big question was, how did we do it? How did we get such a response? We told them it was because the educational slideshow we developed and who we presented it to. How did we develop the content of the slideshow? Our approach was based on our concern with empathy. We worked hard in many interviews to understand their feelings, their fears, how they would be treated, and our respect for them. We found over 200 people who needed to be followed up with their families for possible tuberculosis infections. We were thanked by the National TB Center for introducing new approaches that could be done in other areas. They wanted copies of our slideshow and our educational programs. The Malaysian Ministry of Health asked for advice in educating population groups about other diseases. They recently had a cholera epidemic and needed help in getting the knowledge out.